Okay. So good afternoon, everyone. Apologies for the delay, but we were running another session and we just finished. I'm Nasreen Alwan, the Associate Dean of Academic Affairs at the College of Health Sciences at Abu Dhabi University. I'd like to welcome you all to our second seminar of the Global Brown Bag Seminar Series. The seminar today is about healthcare technology update from e-health to AI. I'm more than happy to be introducing our speaker today, Dr. Riham Kutub. Dr. Kutub is a visiting assistant professor of public health in the College of Health Sciences at Abu Dhabi University. She received her Bachelor of Medicine, Bachelor of Surgery degree from the Faculty of Medicine at Alexandria University in 1997. She earned then her Master of Public Health with a focus on primary healthcare from University of Alexandria in 2005 and her PhD in public health from the same institution in 2010. Dr. Kutub is working at Alexandria University since year 2000. She served as the deputy of the Quality Assurance Unit for teaching effectiveness at the High Institute of Public Health from 2010 till 2013 and as an assistant professor from 2010 till present. Later on, she joined the University of Modern Sciences in UAE as a program coordinator of the Healthcare Management Program. From 2018 till 2020-21, she was appointed as the head of the Health and Medical Sciences Department at Khwarizmi International College. Dr. Kutub has a vast experience in academia, teaching undergraduate and graduate medical and allied healthcare students. She participated in healthcare programs development, modification, and accreditation in UAE and Egypt. Thank you, Dr. Kutub, for accepting our invitation, and we are looking forward to hearing your talk. The virtual floor is yours.
Thank you so much, Dr. Nasreen. This is an honor to be here today. Regarding the topic, I think that this is one of the hot topics, especially that we need to know what is happening, especially in the time of COVID-19. So I'll start first by a quiz, and I need your input related to certain things. Okay, I'll share my screen first. Okay, and just a second. I have slides. Okay. So please, regarding this, you can enter the slides through the link above. Everyone in? Okay, everyone is in. Can I start? Okay, which medical specialty might be replaced by automation, in your opinion? Please go ahead. I think that not everyone had entered. Okay. So the opinion is related to the medical lab, and two for medical lab and two for surgery. Currently, the focus is related to the radiology specialization, and we will see later. But replacing human factor is not in the agenda. Okay. Mention one smart health application you are familiar with or you are currently using. Okay, smart health, yes. So this is a smartphone. What else? Smartwatch, yes. Okay, so these are two smart application related to health in general, yes, and they are common. Okay, mention one COVID-19 related technology or application you are familiar with or using in UAE. الحصن, exactly. At home PCR, great. Dubai COVID صحة, yes. Okay, this is great. So the most common is الحصن, and most of us are familiar related to this application. Which country do you think has the highest COVID-19 vaccination? Okay. Yes, currently regarding the vaccination coverage, UAE is at the top related to vaccination coverage and PCR. The number of PCR done through in the timing of the pandemic. Thank you everyone for your input. Now I'm going to start my presentation. Okay. I hope that the screen, let me share the presentation with you. Okay, for today, we are going to go through the journey related to the e-health, still the artificial intelligence, also some classification related to smart health in general, the current and future situation of smart health, artificial intelligence use. We are going to see the UAE situation, especially related to the COVID-19 pandemic and the feedback of health professionals. The journey of technology in healthcare in general started by just the adoption of IT, the computer. Then later on, we started to hear the terminology related to e-health. E-health, this is the use of internet, of electronic health record, of health information system. Telehealth had started several years ago, but with more focus currently after the COVID-19 situation. Electronic health surveys, electronic patient surveys, evaluation system reporting, all of these were related to the e-health. Then this shifted to the mobile health, mHealth. We started to have the mobile application, and these mobile applications are linked to certain health system and so on. Now we are having the smart health terminology, and we are starting to hear about smart hospitals, smart cities, the Internet of Things, big data analysis, and the evolution of artificial intelligence. Artificial intelligence is not new. It started in 1950s. The application of artificial intelligence in healthcare started in the 1970s. But in the last few years, there was a leap in the advances related to application of smart health and new technology and artificial intelligence in healthcare. As you can see, in general, information technology in healthcare, we are using it for several reasons. One of them is access to information, just the electronic health record and the electronic the medical record. Also, we need it in the clinical decision making process, and in the management level decision making, either in the health organization or on governmental level. We need input from data from several sources, and based on this, we are going to take decisions related to which programs should be offered, which health problem is having the priority, and this is a multidisciplinary action, and input is coming from several organizations. Related to smart health, everyone is involved in smart health. All the stakeholders are involved. Healthcare professionals, all the disciplines, specialization related to it, patient as customers, the community, also research institute, educational institute, health organization, the decision maker and health authority, governmental level are involved also in S-Health. There are several categories related to technology use in healthcare. There is the Internet of Things, and we'll see examples of it. There is cloud computing, there is a mobile internet. We are hearing about the 5G, the big data, microelectronics, certain devices that can be used in vivo, in vitro, whether it is mobile, we can use it and move, or it is stationary equipment. Also the use of artificial intelligence and biotechnology. These are examples of the classification of the smart health. We are having services, providing services to the people, and these services, it can be diagnostic service, it can be management, it can be consultations. All of these are services. Also related to the health insurance, connecting the data to the health insurance for the claim process and so on. We are having medical devices, whether stationary devices or on the body, in vivo and in vitro. One of them is the pacemaker of the heart. It regulates the heartbeats. It can be either in vivo or in vitro. Also, there are certain application we can use it. The most famous is the smartwatch, and you already gave an example. Also, there is ECG for the heart. We can have a look at the beats of the heart. We can predict if the person is going to have a heart attack currently, and even these devices can send a signal directly to 911 in the US. It is connected and an ambulance will reach the person immediately. These are just examples. We are tackling the tip of an iceberg, okay? Also, there is a connectivity technology. We are having connectivity options all over the globe. Now, an operation can be done in certain country, and the other can see the operation live as a training purpose and so on. The health information system management, this is important currently, especially that the health information system adaptability and flexibility was the key in the success against COVID-19 fight. So you will see that by connecting the health information system to the surveillance system, they started to detect cases and track they can track the contact, and they can take the action and make decisions based on this. There are a lot of application, and then there is the end user. In general, these end user can be the patient or the health professionals. These are examples of the applications related to smart health. And again, these are the tip of a huge iceberg. We use smart health in general in diagnosis and treatment, and any one of us had went to a clinic, had done laboratory tests, or undergone certain treatment, and you have seen you have seen yourself the new technology used nowadays, and if compared to several years ago, there is a huge advance on what's going on. There are certain specialization currently that the process of automation is running very fast in it, especially radiology. Radiology, especially in artificial intelligence, they started to predict the diagnosis related to cancer. They are using certain application, machine learning, and it can predict the lesion related to skin cancer, where it is, and this is a life-saving, especially it is used in a certain type of very, very aggressive skin cancers. Also in radiology, related to the radiotherapy in cancer, there is advances related to it. In radiology also, we can predict the most common sites related to certain types of cancer, or the metastasis, if a cancer can send the cancer cell to another remote area. By artificial intelligence and machine learning, they started to predict these areas and diagnose it in very early stage, which the human cannot diagnose it by the bare eye. In oncology, as I told you, the diagnosis, prediction, which site, which type of tumor, metastasis, even the intervention related to the treatment option. They are using advanced technology, plus artificial intelligence application is used widely in these specialization. In cardiology, again, there is advances related to detection of embolism or a clot, blood clot. Also related to open heart surgeries. Histopathology, also this is one of the specialization with wide automation. Now there are certain types of machine that it can scan the tissue, and it can be seen on big monitors, and can predict which type and diagnosis related to this tissue, and it can be shared at the same time with several health professionals at the same time. Robotic, the use of robotic, we will see later on about this, and telemedicine also. Telemedicine, it started several years ago. It's not new. But during the COVID-19 situation, we started to use telemedicine as an option, so not to reduce the contact of the patient with the unnecessary contact with the health and with the hospitals in general, to reduce transmission of the infection. In health management, we are using currently patient-centered smart devices. These patient-centered devices, you will see that I can use my mobile phone or my smartwatch. it's going to collect certain data about me. And this is transmitted remotely to a health professional, and based on this, they are going to take decision individually related to my case only. Also, the Internet of Things, the smart home can be connected to a smart hospital, and decision making can again be done individually, especially with handicapped and elderly population and at-risk population. There is in vivo and in vitro sensors that will send the information directly to certain devices in the hospitals, and based on this, the health professional will provide specific care to the individual. Disease prevention, currently we are using algorithm. These algorithms can predict the occurrence of future epidemics. They had learned their lesson after the COVID-19. Also, they link it related to certain diseases. If you look at the internet now, you will see open source data related to ischemic heart disease, related to certain types of blood diseases, just like leukemias, anemias, thalassemias. These data, they can predict certain diseases, and they can prevent it. Virtual assistant, all of us are using it, just like Siri and the chat bots. Currently, it is used even in hospitals, in insurance companies, just to reduce for better services. Smart hospital, again, this is the future. Currently, smart hospitals, and even now they are speaking about open hospitals. Open hospitals, there will be no the traditional hospital. They are predicting by the year 2030, there is another option related to open hospital, that a person can be treated at home with connectivity directly to the health professions. Currently, there is research. We are using big data, artificial intelligence, latest technology, specifically for in genetics, in laboratories, in pharmaceutical companies, for detection of mutation and future epidemics. Problem solving, one of them is artificial intelligence, smart hospitals, and smart cities. In health education and medical education, there is again a breakthrough in the last few years related to simulation labs, virtual lab, and the virtual reality, the VR. And I'll show you some example of this. This is an example of two devices, advanced devices. As you can see, the first one, this is digital pathology. The machine that you see, lab technologist will place the slides in it. It will be scanned, and it will be shown on the monitor. Several people can see it. I can also, it can predict the sites and give just like a preliminary diagnosis of what is the problem. Also, there is this portable ultrasound. Several years ago, the size of the ultrasound machine made it only portable within the hospital. Now, this mobile phone and this small device, this ultrasound can be carried around, especially in with the paramedics. With the paramedics, they can immediately detect if there is blood in the chest or surrounding the heart, and or fluids, and they can take immediate action and life-saving procedure on the spot. Also, it is widely used now, these portable mobile ultrasound devices. These are examples, again, I think the smartwatch everyone is familiar with, and the smart health application in our phones. Again, it can give immediate signal to the ambulance in certain countries. The other device you can see, sorry. The other device is the ECG. This, again, it is a portable device. You can take it at home. If the person is at risk, I can detect the occurrence of abnormality or even a heart attack, and it immediately will send information to the doctor. And I can monitor the patient at home 24 hours, okay? So this, again, an example. Ambulatory care, currently there is mobile hospitals, also there is the ambulance, the helicopters, and very advanced and also connected directly to the health professional at the hospital to monitor the patient case while the patient is transported. And here in UAE, they have got some very advanced transportation, especially in the Air Force. Related to the paramedics. This is also another example they are using currently for people who are suffering insomnia and inability to sleep properly. They are using certain devices, and as you can see from the figures, it is reducing the cost related to treatment of insomnia. These are examples of the application of technology in health and medical education. Currently, we have got the simulation lab. As you can see, these are simulation lab. The first one, the simulation lab, I can make a certain scenario, and I'm going to monitor the students on how they are going to react, and I can place this scenario remotely, even from home. And I'm going to monitor what they are going to do. Also, there are control rooms with audio-visual and recording, so that I can monitor the steps and how they are working individually and how they are working in a team, especially in emergency care. The other one is, this is a simulation related to an ambulance. There is certain simulation models. This model, it's in the form of an, you can change it even, and it is working, it is moving on hydraulics that will simulate a moving ambulance, and we can monitor the student how they are going to act. Even it can be replaced to a helicopter and so on. This is the VR related to virtual laboratory. Virtual lab, we are using it for anatomy and physiology. Also virtual lab, we are using it for medical lab students. It's similar to a game, and we are going to see if the student will do the proper steps, proper procedure, and so on. Virtual reality also, we use it especially in surgery. In surgery, if a doctor is doing the surgery currently and the students are using these VR devices, and they are going to see the operation with as if they are doing the operation themselves. And also it is used for the purpose of training of surgeons. The current situation for future health, it is the Internet of Things. We are connecting several devices, sensors, and sending information to the smart hospitals. There are some models related to the smart home model. It's giving information for the health professional in the hospitals, and based on this information, I can take individual decision related to the care and management of these cases. And it is very good, especially for elderly population and for handicapped population. A future smart hospital. Smart hospital now, this is the future. These hospitals, they are using big data, and they are collecting data, analyzing it, and based on this, there is going to be certain decision, and it is connected also to smart devices, smart homes. Also, there is a sustainability element related to the environment, safe environment, sustainability, energy preservation, the way that this hospital is designed. All of this will ensure sustainability. The future, as I told you, one of the future prospect now is the open hospital or home hospitals. This will reduce hospital-acquired infection, and also it will reduce the cost of healthcare. Patient can be treated at their homes, and this will benefit the patient and also the burden on the hospitals. So hot cases can, the care for the hot cases will be in the hospitals, but other cases will be at home. Currently, the advances in healthcare from 1 minute to another, we will never imagine it. Artificial intelligence use is widely in process now in several disciplines, and we will see in the upcoming few years other future perspectives. These are the artificial intelligence in general. This is related to algorithm, pattern, machine learning. So the machine will predict, first it will diagnose certain pattern, and based on this, it will predict certain things, and we can take decision making. The introduction of artificial intelligence in medicine, it started in the 70s in diagnosis and in treatment analysis. Currently, artificial intelligence, as you can see, had started to be part of a lot of things. The basic is the artificial intelligence chatbots. We are using it, I think, daily. For appointments, now they are thinking in using it for the insurance company claims. Also, there is again studies that they want to do it for the emergency room triage and so on. For diagnosis, as I told you, as you can see, there is a lot of application related to artificial intelligence in healthcare. Also in drug development and clinical trials. This will reduce the timing related to the clinical trial and the cost related to it, and it will improve the quality of the produced medications. Patient care and treatment, we have got a lot of artificial intelligence application related to patient care. Again, it can predict the occurrence of certain lesion in a certain area, and based on this, treatment can be done. Gene editing and gene engineering now, again, artificial intelligence is used, and to predict also mutation. If mutation will occur in certain virus or mutation will occur, they can predict the site of the mutation, the nature of such mutation, and also the use of gene therapy in general. These are examples. The first one is related to the use of artificial intelligence in oncology. And the second one, again, this is the prediction of the occurrence of a certain type of skin cancer, and this type of skin cancer is a vicious type. This is again for the use of artificial intelligence in prosthesis for artificial limbs. Robotic surgery, now the use of robotic surgery had started to be advanced. As you can see, these are the type of surgeries that robotic surgery is, they use robotic surgery in it, related to surgeries in the GIT, also certain type of gynecological procedures. These are robotic surgery, and these are the prostheses. And here in UAE and several countries in the Middle East, they had adopted the use of robotic surgery in several hospitals. Also, robotics can be used in other things, just like the disinfection robot. Telepresent robobot, you are speaking to the these robots. There is a health professional, as if we are chatting with a health professional, and it is used in certain clinics here in Dubai. Related to what happened during the COVID-19 period. These are the uses in general worldwide, and in UAE, they started to track the cases, the smart clinics, big data analysis, new models for prediction of epidemics and the pandemics. If there is a genetic mutation in the virus, they can predict where and which part will be. Drug efficiency analysis and telemedicine. In UAE in general, there is a strong health information system, and there is the National Electronic Health Record program, which is called RAITI. This electronic health record, there is a single health record for the person, and you can access it from any health facility, okay? In Abu Dhabi, there is the Malafi program, the electronic health record, and 98% of all the hospitals providing care in Abu Dhabi, they are using this electronic health record. The use of such record was one of the elements related to success related to the management of COVID, because there is a lot of information coming from these electronic health records, and from these records plus other application and platforms used in the UAE, they used all these data in decision making related to how they are going to manage the cases, to track the cases, and even to track high risk cases if they are suffering from heart disease, diabetics, immunocompromised. From the electronic health record, immediately linked to that this is a positive case, they can diagnose that this is a high risk case. Also, there is integration of this health information system with the national ID, and based on this, they also can monitor if the cases is still within the UAE or they had left the country. So it made it possible to track the cases and to track the contacts. Related to the future, now there is the metaverse platforms. They had announced that these platforms will be available in the future. Metaverse platforms. These are other examples. The Corona heat map. I'll show you this. This heat map, they can show the cases and the clusters. And based on this, they can take decision making related to if there is increased cases in a certain area. They will shift screening for this area, disinfection, isolation, and so on. So the Corona map, it provided updated information about the situation of cases and contacts within the UAE. Al-Husn application, all of us had used Al-Husn application. This is the mobile app. Through it, you can see your PCR results, the previous PCR results, your immunization status. If you had come in contact with any cases or any contact, and based on the color, there is the green, orange, and the red. Based on this, again, it was used for protection and entry related to general places. Virtual doctors, this is the telemedicine. They used the telemedicine consultation widely during the COVID situation, and they provided it in Dubai, in several Emirates, in Abu Dhabi. If you look at if any one of you is having the MON insurance, look at it, you will see that there is an option for booking a telemedicine consultation. So this is the virtual doctors. Also, the smart watch to monitor the self-isolation. They used it for the quarantine, for isolation, for people coming after traveling abroad. To monitor their place. Also, there is another application related to this, stay at home. Also, in Dubai, there was artificial intelligence related to detection in the taxi itself, and I'll show you later on. There was a hackathon related to COVID-19. Trace COVID application, stay-at-home application. There is a remote care. I'll show you this in the upcoming slides. Also, there is a smart helmet related to monitoring corona cases, home isolation platform. The most important is the surveillance system. This surveillance system is well established several years ago, but since the COVID-19, they introduced new updates related to it. And in general, this surveillance system is for infectious disease notification system and tracing of the contact. The EDE, I think all of you had passed through the EDE. Later. This is the corona map. It is called the heat map. You can see the COVID clusters and the cases in general. And these maps is connected directly to the certain boards for decision making and so on. This is a Al-Husn application. As you can see already, all of us are using Al-Husn. Also, it can be used for the sharing of reports and vaccination certificates. In Dubai, there was the Hasana Portable. Again, it's an application for the PCR results and the monitoring of cases. This is the rest band, the 19 tracker for passenger landing in Abu Dhabi and for the isolated cases. The stay-at-home application, this application, it will monitor the self-quarantine and monitor if a person had left his home or something like that. This is the stay-at-home application. The EDE COVID scanner, all of us had used it in the malls and gates. The idea of it, electromagnetic wave that will detect the temperature plus RNA, a certain factor. And it was developed by the Research Institute in Abu Dhabi. In the Expo 2020, there was certain robots roaming around, and these robots were used to detect with infrared to detect the cases with high temperature, also facial recognition, and to answer the question 24/7 in the form of chatbots. COVID application, also there was the smart helmet. If you can see this, the police, they used it to monitor the temperature, also areas with crowding. It is used in patrols, and also it was used in helicopters. Okay. The taxi, the artificial intelligence in the taxis in Dubai. Dubai Health Authority, there was certain devices inside the taxi to monitor, again, temperature related to the passengers, to monitor if they are using the mask, also related to the drivers themselves, if they are following the rules or there is any violation. The virtual doctor, the telemedicine, already it is widely used in Abu Dhabi and in Dubai. Through it, you can also, there is free consultation, video calls or voice call, and based on it, requesting laboratory test, radiology, and electronic prescriptions. GOH remote app. This remote app is used also for other diseases, not only for the COVID. So it provides diagnostic service, information guideline, booking and management of appointments, prescriptions, logistics, request renewal of the prescription online. The main aim here that the non-emergency cases, they will not come in contact with the hospital during the time of COVID to reduce the spread of infection. Istijaba platform. It was used to update the pandemic situation. Also, there was data about bed number and availability of the beds, about hospital capacity, availability, and readiness, health professional availability. Field hospital were connected to this platform. The COVID screening centers were connected to, again, this platform. The vaccine update, patient transfer. If the patient is transferred from one hospital to another, again, this will provide certain information. All these data were used by the decision maker and the authority level to take a decision related to management of the pandemics. There was a dashboard summary about the current situation, daily situation of the pandemic. They can detect the cluster cases, they can do screening door-to-door, disinfection, and so on. Home isolation platform, it tracked the cases and contacts. And again, it provided diagnosis and management and follow-up, home visit to provide them with the medication, to do the PCR. Even they provided them with the food, collection of waste for disinfection and sanitary disposal of these waste, and also even the clothes and so on. They collected it for disinfection to prevent the spread of the infection. Okay. Also, there are chatbots that that any individual can, if there are certain common questions, these chatbots can answer it 24/7 and can provide the last updated recommendation related to the COVID situation. Also, they used the way this application during the time of COVID, they can do the prescription for the chronic cases and even in certain timing, there was drive-through to pick up the medication instead of entering the hospital. From the previous application, there was also delivery of medication to the home. Artificial intelligence lab, there was a lab in Dubai. They used it in one of the hospitals to monitor the COVID situation, and they started to predict the mortality and the severity of cases related to machine learning. The 17,000 patients were enrolled and analyzed, and they identify certain risk factors that predicted the mortality causes in certain patients. Smart Salem Medical Center, this artificial intelligence center, it is in Dubai, related to occupational health, PCR, COVID testing, and visa renewal. These are some applications used in Dubai. Health related to the wide use of technology and the health professionals. Currently, the health professionals, they are overwhelmed with a lot of work. Any innovative idea need to fulfill certain things. We are looking for efficiency, no waste. We are looking to effectiveness, doing what is needed to be done. So this is related to quality. Also, the humanity and ethic part related to the use of new technology, confidentiality, data security, experimentation on human, all of this should be taken in perspective. Also, the business model related to investment in health technology. In the last few years, worldwide, there is wide investment related to health technology, and also in education sector in general. The problem is that in certain in the business model, and this will be a topic by itself, related to monitoring the efficiency and effectiveness, and also decision making related to the health professional. They are using certain artificial intelligence application to monitor the health professional, to see the efficiency matrix, utilization matrix, and a lot of inputs related to this. Yes, health technology currently is helping health professionals, reducing cost in certain areas, but in another aspect, it can be a source of burden. If the application or the devices are not user-friendly for the health professional, especially there is a shift from one system to another. And this by itself is going to be a topic for the future. So I had reached the end of the presentation. Please feel free, thank you for joining me, and feel free for questions.
Thank you, Dr. Riham, for this very nice presentation. We really enjoyed it. We'll open the floor, as you mentioned, to questions.
I'll just check the chat. I'll share the presentation with you. Any question?
I think we are okay, Doctor.
Okay, thank you, Rahim, and thank you, Dr. Riham, again. And I'd like to thank the audience. I hope you enjoyed our talk, and please stay tuned for more interesting topics in the pipeline. Thank you so much, and hope to see you again. Bye-bye.
Inshallah. Thank you. Thank you, everyone. Thank you. Bye-bye.